So in order to improve that, you are giving some medication. So the child was on, medicine like diazoxide. It's a diazoxide is a drug which is used in case of I'm Dr. IPS Kocher, pediatric and adolescent endocrinologist working at Indraprastha Apollo Hospital. So I just wanted to share one experience of mine for last, which I recently had in the last 1 week back. There's a child of 4 years old who was brought to me with, bending of legs, and the child is walking with a waddling gait. So, then when I've just taken the history, then there was a plan for a surgery by some orthopedic surgeon to be done for this child for making the legs straight. So I don't know, they were asked by some doctor that you take an opinion from him also and see what he says. So they came to me, and this 4 year girl was, very normal, everything normal from the birth, also everything was normal, history, everything, not taking normal diet, everything okay. And school wise, she was also okay, there was no problem. Activity wise, she was fine. Only thing that she was walking with a waddling gait. No, I know that. So when I started taking out the history from this mother, the mother is quite educated. Parents are educated, well-educated parents. So she said that I was so much afraid of COVID that I didn't let this girl go out for 2 years. I've been kept her inside. March 2020 till now, when recently we found something happening in legs, we told her to take her doctor. Otherwise, we didn't let her go out. I was so much afraid of this COVID. So, and then I told him, okay, anything else you want to tell? So, anybody else in the family having such type of problem, like the legs are bent? So she said, there's no one else in the family with this issue, but this girl has got it, and they have another sibling who's just 2 years younger to this one, so 2 years old. So she said that this girl was very active, but now she is, walking, but she walks with a very, waddling type of like a duck, walk, walk, walk like that. So, then I told her that, okay, so anything else you've not been giving a proper diet? And she said, no, everything was fine. We're giving everything milk, we're giving everything to eat and everything. But she's not been allowed to go out. So when we, they had come with some biochemistry, done already from outside, from the doctor, maybe the orthopedician, somebody who had seen her. And they had done calcium, they had done phosphorus, they had done alkaline, bone profile was done. Alkaline phosphatase, parathyroid hormone. It's a hormone, as PTH was done. It's a hormone which released from the parathyroid gland. It maintains the bone, the skeletal and exoskeletal, features, and it maintains basically bone metabolism maintained by that. So there, that was done. It was very, very high. Vitamin D was done. Vitamin D was very, very low, 3 nanograms. So it's very, very low, 3 nanograms. So very, very low value of vitamin D, very high PTS. PTS is around 900. So seeing this, they thought that maybe there is a tumor in the parathyroid gland and producing so much of PTS now. But still they said surgery was advised for this child, and so when they came to me, I saw the vitamin D levels, calcium low. No, calcium was normal, phosphorus was low, low, not low, but not normal, but very high amount of phosphorus in the urine. So the parathyroid gland acts on the renal tubule and secretes out this phosphorus. So that's why you have this. So I told the parent that we have to just give her some medicine. We get me say the X-rays. You want to see the X-ray, what's happening in the X-ray? We saw X-ray was some fraying and flaying of the epiphysis and the metaphysis. So I told the parent that this looks to be something like nutritional rickets, but I cannot very sure. Let's see. So we'll try to treat her and see what's happening. So we put on vitamin D and and this thing, and this is a mechanism where the PTH comes back to normal. The body has a mechanism to maintain the calcium. So that's how it works. So the calcium will be given along with vitamin D is loaded up every week. 60 K is given till 6 to 8 weeks, and then it starts building up. So when the vitamin D level comes up, the calcium levels come up, the PTS starts falling down. So the PTS starts falling down, and then things become better. So with time, alkaline phosphatase also is very high. So it starts kind of. So with time, everything comes back to normal, and the legs start becoming better. So we will know this on the follow-up, but this is quite interesting to see that a patient. I mean, this girl was not allowed to go, so she did not get exposed to sunlight. Sunlight is only source of vitamin D, is the best source. See, they are vegetarian, so fish and egg are out of the picture. Only mushroom is one form. Mushroom is there where you can get vitamin D in the diet. So that lack of vitamin D resulted in all this finding which we found in this child, with type of waddling gait and such high PTH and very low vitamin D. So the body tries to, is a mechanism where vitamin D low stimulates more release of parathyroid to act, and cyclic AMP works there and start producing more and more PTH, and so that it can maintain the calcium in the body and it can carry on. But it does it at the expense of the bone. So the bone become this thing, and they start becoming bending, and there might come changes in the in the epiphysis, and that's why you get a wrist widening, you get bending of the knees and bending of the limbs. So she had genovalgum. That's called as genovalgum, knock knees. In other words, called as knock knees. So this girl had this. So I think with the time, when she will be given this vitamin D and she will be given calcium supplement longer, her PTS will come back to normal and everything. So what I wanted to say that see, when just in education, everything being there, just not allowing the girl pay children to play. So maybe that's why there are a lot of cases coming up of vitamin D deficiency during this COVID time, because of lockup, because the kids were not allowed to go out, kids stayed inside the house. So they had you can see from mild, who may some complain of some maybe some muscle weakness, some muscle, till till a state where they are basically where they are having more, they are having still symptom like bending of bones. So it's very manifestation, a wide manifestation. So I just wanted to make everyone make him understand that vitamin D is very important, and you can get such manifestation of vitamin D deficiency. It's just because of the lack of exposure to sunlight, and the source of vitamin D is not there much in food. So you have to give a supplement. So they're never given their child any supplement of vitamin D. So if the child is not exposed to sunlight, it is good to give supplement vitamin D to them, so that they, this thing they do it. We are getting we get vitamin D deficient patient, but like this, who has not been exposed, is very rare with this type of scenario these days. So that's one of the cases I wanted to, elaborate. Another very interesting case which I came across in the last 1 month was a child, a child of 4 months with hypoglycemia. So this child had got, persistent hypoglycemia was there. Even after giving calcium and all that, it was not improving. So basically, hypoglycemia. So even after giving sugar, dextrose, the baby was still getting hypoglycemia. So this hypoglycemia, when investigations were done to find out what's happening, the critical sample was taken, and this was this has been done in some other hospital, So they were giving a picture that maybe this patient is having a case of hyperinsulinemia where they need, something to improve the insulin level, and that's because high insulin levels, sugars keep on falling. So in order to improve that, you are giving some medication. So the child was on, medicine like diazoxide. Diazoxide is a drug which is used in case of hyperinsulinemia. So critical sample already done in a hospital there, and then before they came to see me. So in that they had shown that child has got high insulin, normal growth hormone, normal cortisol, all these things are fine. And then once this thing was put on, this diazoxide, they decided, but still the sugars were falling. So when they came to me, we found that this child you have to get some genetic studies done. It takes time. So we put the child on diazoxide, Necozide. It's also another drug which helps in improving. It's a synergistic effect. So increases sugars together, work together with increases sugar. Along with octreotide was also given. So this is another drug which is used. It's a somatose analog which helps in raising the sugar. So by giving this somatose analog with diazoxide, the sugar started becoming. So the child is doing well now, and he's back home. If he was discharged from the hospital, back home, and he went back, and then he's doing well. So we're following him up, and the sugars are being maintained. But gradually, we're tapering off the this thing. We're still waiting for the genetic studies. They have not come back. Once the genetic study will come to know what exactly is it. Is it transient hypertension, or is something diffuse? It's something happening in the pancreas. So then accordingly, you have to decide further what to be done. So this is, in another interesting case, which is basically called as hyperinsulinemia or congenital hyperinsulinemia. So that means from birth it is there, the sugars are presenting. So it can present at birth, it can present later, 1 month, 2 months, 3 months away. This is also an interesting case, which I wanted to, make everybody know. So, you're welcome to discuss any case if anybody has with me related to pediatric endorsement. There are many more cases, like this, which I can, talk, especially the one recently we had one child who was diabetic. Her sugars were high, around 400. An 8-year-old child, sugar was very high, and then so this child was treated with insulin, and after suddenly what happened, this child started improving, and become sugar became started becoming normal, and after some time the child did not. So initially the child was on basal bolus insulin, and then was put only on, so the child improved, and gradually for the bolus requirement became less, and then only basals were there. So we do not know whether this is a honeymoon period where the child, its own resilience starts production, or maybe there's something else. So we also asked for a genetic study in it, because we're finding some of these small kids are also having MODY. MODY is a different type, mature onset diabetes young, but it is happening in the younger population also. Maybe it is a, so we don't know. We're just trying to find, because there's something. This girl was quite obese, so which is very uncommon to find in type 1 diabetics. That's why we asked for a MODY study, and we'll see. But we're still waiting for the results of that. So these are some of the cases I just wanted to make and highlight among the, the, uh, the the doctors who are with this forum. So thank you very much. You can note on my email if there are any queries. You can IPS coach, KOCHR 2924 at gmail.com. And the rest, the communication can be on email, and we can discuss if anybody has any queries or anything related to pediatric and adolescent. Thank you very much for the patient listening.